Hi, and good morning to the first of these Getting Back to Work seminars that has been put on by Humber Growth Hub. This one here today, we'll be talking about offices and social distancing and getting back to work in the workplace, mainly relating to offices, although it does have a lot of crossover to different sort of industries here. First of all, I'm just going to welcome David Talbot, who'll be talking through some of the measures that he's put in place in their business to get back to work and sort of make sure people are safe in the current climate. I'll be going then through some of the measures you can put in place. I'll be talking things like risk assessments and that. But first of all, I'll pass you over to David, who will talk to you about his business and what he's going to be doing. So,
okay,
David.
Thanks very much, Peter. Okay, so let's just hope this works. Oh, I should have control now, shouldn't I?
You should have control now.
No, we had planned this before.
There we go.
Oh, there we go. Okay. Thanks very much. And so my name's David Talbot. I'm the chief exec of Catch, which is an organisation based just outside Grimsby in Stallingborough. And yeah, I just thought really that a lot of you may already have returned to work, but I thought I'd just kind of just talk through some of the measures that we've put in place and the process that we went through to ensure that that our site, which can be quite a complex site, was safe to enable our delegates, clients, and of course staff to return to work to be confident to be able to return to the site. So for those of you who don't know Catch, sorry, I think there's a delay in actually. Oh, there we go. So for those of you who don't know us, we're a non-profit organisation. We were set up by industry for industry. And we offer three core capabilities. We offer skills, we offer membership services in terms of networking, events and conferences, and we offer technical services as well in terms of a consultancy. We've got a 10-acre site with a fully functioning manufacturing plant that's used to simulate for apprentice training and other activities. So as you can imagine, we've got quite a complex situation in terms of recovering from the COVID situation. So in terms of an organisation that offers networking, events, conferencing and skills, you can imagine that our model is all about bringing people together, which is the exact opposite to what we're trying to do in terms of the measures that we're taking for the coronavirus. You know, and our delegate profile covers young 17-year-old apprentices right through to people coming to the end of their careers who are doing some retraining or upskilling or whatever. And also we can bring up to 100 delegates together at any one time for meetings and conferences. So what was important for me when we set up when we shut the site down on the 23rd of March was that we started planning straight away for the end of the lockdown period to ensure that the business could get back up and running in a safe manner and to give confidence to all those delegates and staff and clients who use our site on a regular basis. And so we had to hit the ground running when we came back, and considering that about half of the staff were on furlough at any one stage, it's really important for our business that we were ready and we were prepared. So looking at our site, you can see it's about a 10-acre site. As I say, we've got a wide variety of delegates that use the site. We can have up to 300 people on site at any one time. We've got 4 different reception areas. And with half the staff, as I say, being on furlough at any one time, you can imagine that we're quite stretched in terms of planning to recover and man those 4 reception sites. And it's a buzzing site. You know, before the lockdown period, before the back end of 2019, you know, we were buzzing as a site, and it was fantastic to wander around and just feel the the excitement of having loads of delegates on site, and it's such a very different space now. And so it was really, as I say, important for me that we get that business up and running as soon as possible. So what I hope that will work next is I've got a little video run through of the site just to show some of the measures, just to give an overview of some of the measures that we've put in place. And I hope this does automatic work. Yeah. So I don't think there's any sound, but the point I want to make here is that you know, we had to consider a multitude of aspects when we started getting our plans in place to come back onto site. I have got some other slides to go through the detail, to go through it in a bit more detail, but hopefully this just gives an overview of some of the things, and some of them are obvious things that I'm sure everybody is putting in place. But for us, it was important that we communicated and also that we had plenty of signage to make sure that there was no confusion for people coming using our site. And creating this video was actually really important to us because it was key for us to get that communication message out there, to make sure that everybody did have confidence that when they came on site that we had put measures in place and we had gone through a good process. So just by putting that video out onto social media, on our website, in our newsletters, actually created quite a bit of debate, and I think has been very useful in terms of getting people back into using our site. Okay, so what process did we actually go through when we knew that we were going to start to build things back up again? Well, actually, it started, as I said, right at the beginning of lockdown, and what we did is we made sure that we engaged with staff all the way through the process. And I know this sounds like sucking eggs, but and I'm sure everybody's doing this, but we had a weekly team check-in. That was absolutely critical. And all the way through, I kept asking the team, do you still want this? Is it still useful for you? Is it important? And I got a positive response back. Actually, just as important as the regular team meeting, we also had a Monday morning furlough coffee morning. That was difficult. It was hard work to keep that going because sometimes people didn't want to engage. But I wanted to make a point that those on furlough were doing as much for the business as those who were still working through, and those who were attending site, or those that were working from home. It was just as important for those on furlough to make sure they felt they were doing their bit for the business, and they were. Without furlough, as I'm sure many of you out there are in the same boat, without furlough, we would have been in a significantly worse position. So we tried to create the right ethos within the team. We tried to engage everyone, keep them informed what was going on. And then as we started to build back up towards reopening the site, which we did on the 1st of June, by the way, we started to bring people in slowly in a controlled manner. We undertook delegate walks around the site. That was absolutely key. And those delegate walks were about trying to break the system. You know, we tried to act as if we were, you know, that idiot that didn't know what they were doing. So we walked around the site, but we also brought in all our tenants as well. So we sublet our site to other training providers who offer services from our provision. And that was really important that we engaged those providers, because they'd all got their own risk assessments, they'd got all of their own processes, they've got their own concerns, their own worries. So again, with our tenants on site, we had a regular weekly update, and we put all of their information that they had in terms of risk assessments, processes, procedures, plans into one repository, into one SharePoint site that anybody could access, and we started to build our processes from there. So very important we engaged the team, very important that we engaged all our tenants and everybody using site. We brought the team back, as I said, in a phased way, and we've now probably on a day-to-day basis probably got half the team in at any one time. But as people came back, another key factor was that we took everybody through a toolbox talk, i.e. we sat them down, we talked them through the processes individually, and then we walked them around the site and made sure that they were, our own team were aware of all the processes and procedures that we'd put in place. And then finally, as I mentioned with the video, it was about getting that message out that we were a safe environment to come and visit. And all of that meant that we could start training from site from the 1st of June, and it also meant that we actually had meetings on site as well. and we're hoping to get some conferencing up and running soon in a blended way very soon. Of course, we've put in a risk assessment process. I'm sure you're all doing that. But I suppose I just wanted to kind of make the point that our clients wanted to see our risk assessment. There were two reasons for doing it. One is, as I say, our clients wanted to see that we put a full process in place. And secondly, it drove our solution. We used our risk assessment in terms of identifying the risk, mitigating the risk, and then identifying the residual risk and how we were going to manage that. And that then drove the solution. And that's what the risk assessments are there for. And I understand you're going to go into a little bit more depth on that later on. So, as I say, that risk assessment drove our solution, and we looked at our solution in terms of three core areas: the site itself, out and about around the site, the communal areas, and then the office and training areas, the office rooms and training areas. So when you look at the site itself, as I say, we've got quite a complex site. We've got 4 reception rooms areas, and we've got lots of walkways and roadways. So what we tried to do, as I say, we tried to break the system. We did lots of delegate walks. We tried to act like idiots and struggled deliberately to find our way around the site. We put up signs. Clearly, I'm sure everyone's doing that. We restricted traffic on site, and we've got turnstiles. The access to the site is via turnstiles. So that was an innovative solution we had to come up with. We locked down the turnstiles, obviously, because we didn't want people touching the metal bars. So as you can see from the picture there in the top left, we devised a walkway around the turnstile by lifting the road barrier that's in place on that picture there. So it just identifies that there's quite complex issues sometimes that we had to resolve. And of course, by solving one problem, you create another one. So by opening up the barrier, you make the site less secure. So we had to bring in other measures to balance off against that. So it was quite tricky, of course, to manage the whole site. So that was around the site itself. Then you've got the communal areas, the corridors, the toilets, the reception areas. And we put in measures that I'm sure many of you have done in terms of sign. We went over the top on signs just to make sure that it's absolutely clear where you have to go and how you have to report to the site. The step markers on the right-hand picture are just generally down corridors. So that's not to maintain a queuing distance. That's just to identify, so when you're walking down the corridor, how to keep your distance. We had a reception system whereby we only had one person in reception at any one time. We've got one-way systems right through the site. We've opened doors, which again creates another problem because, of course, there are fire doors potentially with a fire risk, and therefore we brought in really robust procedures to close those doors when there's any issues, and also to close them when there's no delegates or anybody in the building. So again, like I say, there's balance. You have to balance safety in one aspect with other criteria. And finally, the office space and the classroom space. And you can see here a classroom. We had to be clever try to be clever as to how we manage the 2 meter distance. It's not easy, We went from a room that could have maybe 20, 25 delegates to one that could have maybe 8 or 9. Clearly, that's affected our business, but we have to do it. We've got one way in, one way out through our classrooms, and we've tried to do the same with our office space where we can as well. And right across the site, we've had to bring in extra cleaning regimes. So again, we've had to be clever in that with toilets. We've got only one person in a toilet at any one time, so you've got a sign that you turn over when you go into the toilets if they're communal. We've blocked off urinals, so we only have one toilet that needs cleaning, and that has allowed us to bring the cleaning staff and put on a regime around cleaning handles, cleaning desks and that kind of thing. So we've had to have a re-emphasis in terms of cleaning. So all of that has meant that we have managed to bring back some of our activities, which, as I say, are all about bringing people together, the complete antithesis of what coronavirus has done to us. So this is an example of a client who wanted to hire a room for a meeting space in a blended way. So they had video conferencing as well as people in the room, and they had a presentation on. We've come up with we think we've come up with a clever design in terms of the tables. which allow people to look at the screen whilst also maintaining social distance and having and maintaining that dialogue in the room itself. And we got good feedback for that, which we're really pleased about. And they said they will book us again, which is exactly what we need to keep the business going. And that's just a skills course. We've also started to run our training courses as well, and we've been getting great feedback for the measures that we put in place. So hopefully we feel that we've done it right. And that's really all I wanted to get over. So just one final point really that I wanted to mention was you think you've covered everything and somebody will beat you. We've put hand sanitizer and surface spray out right across the site, everywhere we can think of, before you go to toilets, before you go into offices, before you go into reception. But of course, initially we just put the hand sanitizer out and the surface spray. So what we found was that delegates were then using the surface spray to clean their hands with. So now we've had to put signs out to explain which is which and what you've got to use them for. So my point there is, when you think you've covered everything, you haven't. And that's really all I want to say. Hopefully I haven't taken up too much of your time there. Just wanted to cover off our kind of thoughts on our journey really. So if anyone's got any questions, then I'll be happy to take them.
Thank you very much, David. Certainly some quite useful information there. I've got one question come in. Have you had any reluctance in staff returning to work or to site since reopening?
Generally no, because as I say, we've kept them updated all the way through. What we've had though is we've had staff that have been nervous about coming in, not reluctant to come in, but nervous about coming in, and maybe particularly maybe amongst the younger elements, those that have maybe struggled through this whole lockdown period, and yeah, they just felt nervous about coming back. They weren't sure what they were coming into, and that's why what we call the toolbox talk, which is traditional across industry. Around health and safety, risk and risk. That's why that was so important for us. Every member of staff was taken to one side, was given a complete talk around the procedures and policies in place, and a walk around the site. So hopefully that helped to allay any fears. But we didn't have anyone who said, "No, I don't want to come back," but just nervousness.
Thank you very much. I think the key thing now, as you're saying, is communication. Communication is certainly key to making people feel happy, whether that be clients or whether that be staff as well. But as I say, some really good practical ways of actually getting things back into normality, or the new normal, as we keep hearing. So yeah, thank you very much, David, for that.
Okay.
So I'm now going to talk a little bit more about sort of risk assessments, a bit more about actually getting back in and what you need to do from a practical point of view. So just going to give you a quick introduction to myself. I'm Peter Daniel. I'm a senior business advisor for Blue Orchid, and I'm a NEBOSH accredited health and safety advisor. So the information hopefully that I'll be giving you is going to be fairly practical. I've had my own business. I've run my own business for a number of years. And that's the way I like to look at sort of health and safety, not in terms of necessarily the paperwork point of view, as much as let's actually get this to work in a real life situation. I do encourage as many questions as we can possibly get. So if you do have any questions, there should be a little question box in there. I know we've had a sort of a question or so already for David. So if you've got any questions, stick them in there and I'll come back to those at the end and hopefully answer any questions that people have got the best I can. So what am I going to talk about today? The main thing I want to talk about is risk assessments. Risk assessments is going to be the key point here. So I'm going to talk about that one. But then I'm also going to go through what are some practical measures, what are some of the government advice of what you actually need to put in place, so you can start trying to build those into those risk assessments and get them sort of managed so that we can move back into work. Now, some of you already will have these in place. Some of you will have already started back in work and maybe looking at this in just a case of let's make sure things are right. So hopefully there's going to be something in there for everybody in today's session. So just to start off, I just want to talk about social distancing and what actually is social distancing, because we've heard a lot about it, and we're all saying we've got to actually keep that in place during the return to work. But for quite a few people, it's, well, what actually is that? Well, it's basically just creating a physical barrier, physical distance between people, so that the spread of COVID-19 and any other sort of disease, I guess, for that matter, is reduced. The UK government currently suggests 2 meters. Now, I've seen a lot in the news at the moment saying about other areas are reducing that down, but currently it's 2 meters. And that's one of the first points I'm going to make here today. A lot of what we're speaking about today is, I'm going to say, correct as of today, but things are fluid, things change. We're getting more information all the time, and people are trying things out. So there's new bits and new ways of managing this all the time. So you do need to keep on top of this, keep up to date, and see what the best way forward is. But as I say, at the moment, it's managing that 2 meter distance where possible. I'm going to say where possible is a very key phrase, but ideally it's that 2 meters. The idea behind this one is we need to reduce the spread of it. Reduce the spread so we can reduce the pressure on the health service. And we all know about that with the sterling job done by the NHS. So it's to reduce that pressure. The other thing here is we've got to think about that communication and that reassurance. People want to feel it's safe. And there's something involved in that. And like David was saying, there is that reluctance. Certainly, I've got that reluctance. Do I really want to go down the shops? Is it safe to go down the shops? How long is it going to take me to go down the shops? So all of these things start coming to your mind, and change is a big issue. Mental health at the moment is a big issue. So it's something we need to take into account when we're looking at returning to work, whether that be from a client's point of view or whether that be from a staffing point of view. You've got to think about people's perception as much as what is safe and right to do. Safe and right to do is the first thing you do. After that, we go possibly above and beyond because of people's perception, because it's a change aspect. So first of all, who are we protecting? Well, we are protecting our workforce. And this is one of the things that I'm going to say is not a key change. There is no change here. Health and Safety at Work Act says we have to protect our employees. General duty section 2, that hasn't changed. COVID-19 is just a new threat. It's not a change to how we go about doing it. So all we're going to be doing at this point is looking at doing a risk assessment to see how this new threat that has come about is going to affect our business. And it's nothing more than that. So it's no more than you'd be doing for any other new threat that comes along. The other people we need to think about is going to be our staff. So we need to look at protecting our staff. So moving on to our customers even, because your customers are in the same way. They need to be protected in the same way. They're not going to come out. They're not going to shop with you if they do not believe things are safe. So that's what we're going to be looking at. How do we protect staff, customers, anybody who has any interactions? That's the main points of call here. We're going to be doing this by doing a risk assessment. And that's what I want to spend most of the time today looking at, is how we do a risk assessment. So first thing I'm going to say here is return to risk assessments. Who does the risk assessment? Who needs to be doing it? Well, it's you as the business owner or you as the manager. It's not something you buy somebody in to do. I say that as somebody who does risk assessments for people, that realistically, I cannot complete one for you. The reason for that is I don't know your business. I don't know what you're going to be doing. I don't know the staff interaction. I don't know who your staff are. You're in the best position to be able to do this. And I've seen lots of things where people have said, well, I'll do a risk assessment for X amount of money and you get this nice posh COVID risk assessment. That's not what you want to do. Risk assessments are not a piece of paper that should have any dust on them at all. There are a few pieces of paper in business that should be put away, be full of dust, never looked at again. Risk assessments are definitely not one of them. They should be, realistically, I'm going to say, the grubbiest piece of paper you've got, because they should be looked at the most. And that's the way things are made safe, by people actually looking at them, people reviewing them, people seeing what needs to be done. And David touched upon this. He said that he had to share his risk assessments with his clients to show what he'd done. And you're going to have to do the same. You share them with your clients, you share them with your staff, you make sure they understand them. So they need to be readable and they need to come from you. That's the biggest thing, the most key point of any sort of risk assessments. It's not about how it looks, it's more about how it's used. And I certainly think there's going to be lots of, like I said, HSE are going to come down on this going forward, about people who have had COVID-19 risk assessments done for them, filed them in a drawer and not actually implemented much about it, or not implemented it in a safe way. When I mean in a safe way, something that is related to your business. So you need to do it. Now, if you want to get one of those done, that's great, but you need to review it, you need to add to it, you need to make sure it works for your business. So I'm going to talk now about how we do a risk assessment and what we need to show in one. And as I said, I'm not going to worry about the format of this one. I don't think we need to worry too much about the format of this one. It's more about identifying the risks. Okay. There are standard formats. If you want to have a look online, get some on there. You know, those are really some good places to get them. But it's going through this standard list of controls that we need to think about. So first of all, what do we need to think about? Well, we need to identify the hazard. So we need to go around the workplace and we need to identify any hazards that there are around there. Now, the obvious one here I'm going to pick on is a hazard may be touching doors on entrances. Okay, you can see a hazard there that people are going to have to open a door, so they're going to have to touch the door. There is a hazard, and it's going around and working out what those are. There might be other ones such as break rooms, tea and coffee making facilities, shared computers. The stairs was another one, and certainly you saw David identified several of those, and some things like turnstiles. So this is where you need to walk around, take a clipboard, simple as that, walk around and go, right, what are the risks? There's a point, there's a point, there's a point. How do we go about solving it? The next thing we need to identify are the people at risk. Let's take the turnstiles, let's take the entrances here. So the people at risk, who is that? Well, it's anybody coming in and out of that building or through that turnstile. These are the people, which can be staff, visitors, deliveries, anything like that. So we then go through and say, well, who are the people at risk? The next thing we look at, which is all done pretty much at the same thing, is the evaluation of the risk level. I've seen lots, again, of different ways of doing this, but realistically, it always boils down to looking at two numbers. And I tend to do it is I tend to give a number from 1 to 10 on these two numbers. So the first one is, how likely is it that the risk will take place? As in, how likely is it that somebody could contract coronavirus from touching something? Now, we know that's fairly high. We know that's a reasonably high. It's not 100%. If it was 100%, I'd put it at level 10. If it was at no percent, it would be at level 0, but it wouldn't be a risk. So say 1 and somewhere in there. So I'd probably put it at, say, 6 or 7, something like that. It's a reasonably high risk. Yeah, more than 50-50 if that is there, round about that sort of level. So that's the one level. The next one we look at is what happens to that person if they get it, or not if they get it, but if they touch that surface and get it on their skin. Well, let's say you open a door and wash your hands straight away. The chances of you getting infected of that is low, very low, because washing hands, we know, is a great control measure. So if that was the case, then that would be at level, say, 2 or level 3. But if no hand washing facilities were in place, then it'd be reasonably high at level 6 or 7. This is where we start looking at how we put measures in place to reduce those numbers down. So what we could have at doorways is the risk of somebody actually getting it on them, getting the virus on them, I'll say that, would be fairly high by touching the door. But what David's done there is he's just got rid of the touching the door. It's 0. Risk gone. Out the way. Don't have to think about it again. We don't have to do the second one because there is no risk there. That's the best answer. However, we can't get rid of all doors. We can't get rid of everything. So we might say, well, they're going to have to open that door. There is no other option but to push open that door. So what can we do to minimize that? Well, as soon as people come in after that, hand washing facilities, hand sanitizer, that reduces it down. We're trying to get those numbers as low as possible. As low as possible. We want the risk to be as low as possible, and we want the chances of the infection, I'm going to say, to be as low as possible. So this is where we start looking at those risk controls. We evaluate the risk. We look at ways of putting those risk controls in place. What can we do to reduce them? The point here is we always try and reduce that first number first. So the number of the chance of something actually happening, which sometimes is fairly easily. Just get rid of that risk completely. Remove the door. Not always possible, but that's always the first point. The second one is reduce what happens if that risk actually takes place. The final thing we need to do at this point is we need to monitor. We need to review the situation. And this is where David talked about this one in quite a bit of detail, that he tried to break the system. Health and safety. Now, I often have it described to me as common sense, and I will totally agree. Health and safety is purely about common sense, but what I will say is there's no such thing as common sense. We all know that. I've certainly made mistakes. You know, the amount of times I've gone and got something out of the oven and got, you know, thought, oh, oh, hang on, that's hot. Yeah, I'm sure we've all done that sort of thing. And then you think to yourself, why did I do that? So we do need to monitor it. We do need to put those stupidity times in place. Monitor, review it, make sure people actually adhere to it. Now, the thing I haven't put in here, which is the most important part of the risk assessment, and I've mentioned this before, but I haven't put it in this part, is the communication. How do we stop people from being stupid? Well, I'm going to say it's almost impossible to stop people from being stupid, but what we can do is the more we enforce what we have to do, the more we communicate that across, then the more likely it is that people won't do something stupid. We all stop at red lights. Why do we stop at red lights? Because we know we have to do it. It's instilled on us from a very early age that red lights mean stop. I took my lad out for a bike ride yesterday, and that was the sort of things I'm going through with him, and he's 8. So you will have that instilled upon him. By the time he's driving, he'll know to stop at a red light. We don't have that time. We don't have years to go about. But the more we can enforce this to people, the more they are likely to do it. And also the more confident they are. People fear change. And returning to work is something that people will be scared of. I don't want to go down the shops because it's like, where do I go? How do I queue? What do I do when I get in there? Yeah, that communication is going to be key. So we're going to have to look at the ways of communicating. The first and the easiest way of this one is make sure these risk assessments are readable and are supplied to your staff. So at very minimum, I would do is send them out to your staff before they return to work. For a lot of businesses, I'd stick them on your website. Make sure people can see what you're doing. That will increase confidence. It will show people that you're actually proactive about this, and it will make everybody feel more confident going forward. So, as I say, that's a risk assessment. Go through the hazards, look at what it is, look at the people who's at risk during any individual part, evaluate that risk level, and the evaluation is quite important because you can see what are the steps you need to put in place and which ones are the most important. And then we finally put the risk controls in place. If we can eliminate the risk totally, that's always the best part of call. That's always the first thing we need to do. But sometimes you can't do that, so we're just lowering the risk. The recording part of it really is purely about putting something in a file, and is not necessarily, it is important. If you've got over 5 employees, you do have to have them written down, these risk assessments, but the communication of it is the most important part, and the filing of it is more about making sure that communication has been done and proving that that has been done. One of the points I'm going to make here about risk assessments actually is a lot of people say, I don't need to do a risk assessment if I've got less than 5 people. No, you need to do a risk assessment, but you don't have to have it written down. But I would suggest everybody has it written down. There is no reason not to have it written down. It is something that needs to be written down, whether you've got 1 employee, no employees, doesn't make any difference. Everybody needs to write it down, but always monitor it. This situation will change over time. The advice will change over time. The ideas will change over time. So keep it reviewed. As I say, this should be the most used piece of paper in your business. It's never put away. It's the grubbiest piece. It's the piece that people read every day. Okay, so I spend a bit of time now talking more about what measures people can put in place and ways that we can go about that. So first of all, I'm just going to start off just with a few photos here of things. I'm going to say I've stolen these from mostly from the BBC, but a few places that we need to look at. Now, the first couple here, I'm going to put, I've gone for the sensible ones to start off with, or semi-sensible. So we've got a lift here. One of the things that we will have to look at is areas where people congregate. So when we're looking at risk, we're going to be looking at areas people congregate, and lifts are one of them. Not exactly the most conversational people there by the looks of things, but a few measures that have been put in place there. The other thing is going to be entrance and exits, and we're going to have to manage people. Coming through, and certainly how many of us have been down the shops recently and looked at the queue and go, oh my God, how far is that? And then realize there's only about 4 people in the queue, but because they're 2 meters apart, it means that the queue looks absolutely massive. So again, we might have to look at queuing systems and stuff like that. I want to talk more about this when we start talking about individual areas of the business. But I just wanted to put these couple of pictures in place. What I will say here is we need to be creative. We need to think about things. We need to make it sort of feel a little bit normal. That first photo does not feel very normal. It's not a lift I would like to get into. It's not very inviting. And to get people to follow these sort of things, we need to show that it's it's sort of normal and feels fairly sort of safe going forward. So I wanted to bring this one in really, and this is, I'm going to say, 2 a little bit more comical examples of social distance. So the first one, I'm sure it's been around social media quite a bit, but it's over in Germany, a cafe in Germany, trying to get people to social distance. Again, is it normal? No, but I'll tell you one thing it's done. It's got it all over social media. It's got people are sitting there. And it's very innovative. And that's the thing I'm going to say, think about how to be innovative in what you're going to do. Sometimes going that extra bit and making it abnormal actually makes it feel a little bit more normal, because at least there's a little bit of humor involved in that one. The second one I've got here, I actually much prefer. This is my favorite one of the lot. And this is a restaurant. I think it was in Singapore. I can't remember. Don't hold me to that one. Where what they've done to get people to social distance in terms of not sitting next to each other, they've just stuck a panda, a cuddly toy, in every other's chair. So you can't actually sit in that chair. That to me is what we need to be looking at. That's the sort of ideal sort of situation in terms of it's fun. It feels sort of half normal. It's not quite normal. We're going to be in this new normal. But we're looking at ways that we can get that sort of fun aspect into it and feel a little bit. We don't want to be sitting behind these screens and that for the rest of eternity. That's not what we're looking at trying to do. We're looking at trying to put things in place that people become not to notice. And I think that one is quite a comfortable one, and certainly, as I said, quite fun. So what are the key points that we need to consider? Well, the key points we're going to need to consider really is what is your workplace? What areas do we need to think about? And like I said to you before with the risk assessment, we go round each part. And it is a case of trying to do a risk assessment for each and every part of your business. So we need to look at all aspects of the business. We need to look at car parks, break rooms, the actual office itself, the entrance, the stairwells, the kitchens. But also think about how people get to and from work. One of the things in a lot of the government advice has been a lot about how people transport themselves to work. And with the government's recent announcement that people have got to wear masks on public transport, stuff like that, that's going to have a key impact on people wanting to come to work and key impact on people actually attending work. So I think this is something you really need to think about as well. It is still part of your responsibility. The other thing we need to look at is how you manage employees with COVID-19 or who possibly may have COVID-19. So current advice here is if they show any symptoms, no matter how small, they should not attend work. One of the things you need to do is communicate this to your staff that you do not expect them to attend work, and what is the policy and how they report if this is the case. When I say what is the policy, you need to review your sickness policy. How does that affect them? One of the ways to stop people from coming in ill, obviously, is to have a very clear policy in terms of what's that going to mean. Something which I'm sure will be asked is whether you need to pay sickness. So that's more, I'm going to say more of a HR one than a health and safety one. But things like that may well help your policies in terms of people not attending work. It's certainly something which may come into it. You can't discriminate against anybody. That is still the key. That hasn't been superseded. None of this COVID-19 support actually supersede any existing health and safety or discrimination areas of business. So you cannot discriminate against people. So if you've got people who are having to shield, who are pregnant or anything like that, then you cannot discriminate them in the same way as you couldn't before. It doesn't change that. So your policies cannot change any of that one. And the final one here I'm going to say here is about your activities. What activities actually take place? We spoke initially very briefly about social distancing and what it actually is. And there's very clear guidance here in terms of returning to work. The clear guidance is if you cannot social distance, Does it actually need to take place? We will talk about PPE. We will talk about measures to put in place where social distancing cannot actually be implemented. But think about the needs. Think about whether that activity is actually key to the business or whether it can be changed. And this kind of comes back to that risk assessment of that first number. When I said you put a number on that, what is the risk? If you can eliminate that to zero, as in the activity is not taking place, so therefore there is no risk, you've got rid of that risk assessment. You've got rid of anything there. And with the business still operating, does it actually need to take place? Key one here is going to be meetings. Does that meeting need to take place in that way? Hang on, does it? That's the question. So to go through the various aspects and various parts of an office. As I said, does the activity need to take place? And the first one I want to talk about is working from home. Many businesses have been successfully working from home for the past few months. So do we need to return to an office environment? The less people who return to an office environment, the easier it is to implement social distancing. If people are working from home, there is no risk. So the risk is reduced, I'm going to say significantly. There is still a risk, but it's certainly down to that sort of one on that scale I spoke about. So do we need to return to the office? Do we need to return to the office in the same way as we did before? And that's the first point to think about. I'm going to mention schools here, and I know only this morning I read an article saying that primary schools are now unlikely to return in full until September, which is going to have an effect on your workforce. One of the things you're going to need to think about here is, can people return? They haven't got childcare, or childcare is an issue. Can they return? So you may have measures you're going to have to put in place to help in terms of that childcare, allowing people to work from home when you were hoping that they might return to the office. But let's assume children are going back to work. Let's assume a bit more normality here. That will help improve people's efficiency from working from home. So even if you've got staff who are working from home and said, look, they're not quite as efficient as they were before, well, let's look at ways we can put things in place to make them more efficient. Some of that will come naturally as they get used to it. Some of it will come naturally as children return to work. Certainly, I'll get more efficient as my children go back to work. So that's something to think about. You know, long term, this might well be an option, even if it's not quite perfect at the moment. Maybe we need to put things in place like upgrade IT and stuff like that, so they have more ability to work from home. Maybe we need to put something in place so that you're saying that they are going to be able to work from home for a much longer period of time, so they put things in place. For example, I'm certainly converting an area to work so that me and my wife can work from home more long term, whereas it always used to be just me, so we only needed one desk. I now need two. As it's looking like it's going to be for much longer, her work has said that they will be not returning to the office in the same manner as they did. It's like, well, we will look at rearranging our house to manage that one. It's not temporary anymore. Let's make it a little bit more permanent. That will increase our efficiency. That will increase our ability to work from home. And therefore, we will have less need to return to the office. So this is the first part here. Have a look long term about the options for working off-site. For a lot of you, that may not be an option, and you may well want some office staff in. But you say, reduce the numbers, it will make it easier for social distancing. And let's look at it from a commercial point of view. Less office space needed, less cost for you. In terms of what the government have actually said in terms of sort of things like hot desking and stuff, they have said you need to discourage and avoid hot desks. They haven't actually said that you can't hot desk, and they certainly in some of their clarification in their webinars, they did say that they are not banning them at all, but they are discouraging that. One of the things with hot desking is you've got more touch points, and when we go back to those risk assessments, the more touch points we've got, the higher the risk. So removing hot desking and assigning desks to certain people, assigning workstations to certain people will reduce the chance of contamination, to reduce that cross-contamination point. So discourage hot desking, have those sort of workstations there. Try and establish desks at social distances where possible. So we're looking at that 2-meter gap between desks, and certainly David in his showed ways that was being done in a classroom setting. Not always possible, I know. Certainly trying to get as many people into an office as possible. A lot of desks are a lot closer than that. So we need to look at way we can arrange things, and just rearranging the office will reduce down that risk. So for example, back to back is the most preferable way of working than face to face. If not, we're looking at side by side, because the virus, the main way of spreading the virus is from droplets from your mouth. Hence, there's a lot of things about masks at the moment. So therefore, if you're back to back, the chance of those droplets touching that other person is greatly reduced. So maybe you need to look at the ways you arrange your desks. Have them facing against the wall, out of the windows, things like that. Okay, so have a look at that one. We will need to put additional cleaning in place. That is definitely a must, and this is going to be from 2 or 3 aspects. The first aspect is to reduce the risk of that contamination, but I want to talk again about that confidence thing. What is the confidence that people are going to return? They're going to want to see a visual thing in place, that you are taking measures, you have got their well-being at heart, and cleaning is the most obvious. So increasing the amount of cleaning you're going to have to do, and making that visible. So having things like hand sanitizer available, having the ability for people to clean their own desks is going to be key, not just from the risk point of view, but also from people's confidence point of view. So one of the things we might do is have cleaning stations at each desk, and this could be as simple as a squirty bottle and a cloth for every person around. Nice and easy, straightforward. You're also sharing the workload of that additional cleaning. One of the things I would implement at this stage is a clear desk policy. This reduces the number of items on the desk, which makes cleaning easier, and also reduces that contamination side of things. So clear desk policies, a lot of you may well have in place at the moment, but it's certainly a time to get people on board, to start reducing down the clutter around, and trying to reduce that down in the whole workplace, not just individual desks. Here, we're going to have to think about things like paperwork. How is that stored? And this kind of might come back to that working from home. Maybe going and pushing towards that paper-free office may well be a time to do it, because you've got people's acceptance of it. Now is a time to start looking at those policies that you may well have always wanted to implement and thought, yeah, but my staff are not going to be on board upon this. I'm not sure they're going to want to do it. Well, now is the time possibly to do it, because people's views have changed. and they might be a lot more willing to take the place. So clear desk policies, paper-free, all of that is now something you need to think about. Barrier screens between desks. I wanted to put this on there. I wanted to put this fairly low down. The reason I want to put this on low down is barriers are only one step above PPE. And we need to put these in as a last resort. We always try and remove risk to start off with, hence the working from home being top of this list. But barriers are a possibility. Barriers might be a good way forward, depending on how your office is set up. I've seen some really tidy barriers now, but a perspex sheet in between each desk stops a lot of the spread because you're in those sort of bubbles as such. And something several people have asked me here is it going to make things unworkable? I don't think it does make things unworkable, but I do think it makes it change the interaction. It does make things change about. And going back to what a classic office is in the 90s, it was those sort of little pods. Well, maybe we need to go back to that. Think about how people feel. Screens are a good visual aspect, again, to make people feel confident, as well as reducing down the spread. The main thing we need to look at, though, as I say, is removing the risk. And that comes back to avoiding movement within the office. Okay, so if we can remove that sort of movement within the office, then it makes a lot of those sort of barriers and measures and that less necessary. I'm not going to say not necessary, because it's it depends on your risk assessment, but I'm going to say less necessary because you've removed the risk in the first place. You do need to keep looking at these remote working policies. This is the time to push on this one. You're all here doing a webinar, so introduce that, keep that going. Certainly I and we are as a company looking at doing more of this sort of webinar based thing, because not only have we found that it's an efficient way of doing it, we've also reduced risk totally. So look at remote working tools. So this might also introduce things like drop-off zones for equipment and documents. You might put more printers in so that people don't have to travel from one office to another to print things out. So you might have some smaller but more printers in. You might have several different office stationery areas so that people can go and get stationery from a local small store rather than having to go and request it from the main office and walk through several other offices. Create teams. So maybe move your office around so that people who often interact to each other are sitting close by, so they're not having to travel through several other offices to be able to have a meeting. And maybe a staff intranet or a sharing sort of system, such as Microsoft Teams, which I know a lot of people use, just for that office banter, again, to stop people from traveling around the office. Access and egress, entry and exit. Yeah, entry and exit. We need to look into that. We need to encourage people to look at ways of coming into work. So I put there, encourage people to work or cycle to work. When we spoke about risk assessments before, when we started this, we need to look at the whole business. We need to look at the whole aspect. So encouraging people to cycle to work is a key thing. It does, the advice does say that open air and exercise does help this. So they are pushing towards this. And certainly cycling is a massive increase at the moment. You know, I see more bikes on the road than I ever have done. So maybe that's something you want to encourage, and that will also help reduce risk. It may also help improve the fitness of your staff, which may help your business as well. But maybe look at putting bike racks in, maybe look at those sort of things, so that you're getting people to not use public transport, and you're getting other ways into work. Remove touch points, ID cards and swipe cards you don't necessarily want to be using. So you may have now a system where they show an ID card to a security guy at the entrance rather than having to swipe through. That will reduce that sort of touch point. Or, like David's done on his, removed it altogether. Encourage hand washing. Hand washing is something we need to implement all over. It is the most effective way of stopping this spread. So encourage that hand washing. That needs to be at the entrance and exits of really all buildings going forward. People expect that. They'll expect to see those hand sanitization centers. What does that have to be? Is that going to be the kind of squirty stuff or a proper hand washing thing? Well, that's up to you. It doesn't have to be either of those if there's a way of doing it. Realistically, on doors, entrances, things like that, most of the time it's gonna be those sort of wall-mounted alcohol sort of systems, because it's the most easiest, the most efficient to put in place. But there's nothing saying that people come in, wash their hands, go on to work. You know, there are ways of doing that one. We want to stop people from interacting in terms of that social distancing side of things, keeping people at a distance. We need to reduce numbers, and reducing numbers, as I said, in terms of people working from home and offices, you know, makes such a difference. So let's look at the ways people come in to work. If all your staff start at the same time, there's going to be sort of pinch points. They're all going to be arriving at that entrance at the same time. They're all going to be trying to use that lift at the same time. They're all going to be trying to use those stairs at the same time. So maybe stagger the shift starting time. And it only has to be by 5 or 10 minutes to really spread out and reduce down that interaction. Maybe we'll introduce flexible working. And when we spoke about kids not going back to school, flexible working, flexi hours, flexi time may well be a really good way of solving the issue of people being able to work with childcare and things like that, as well as reducing down that contact. We might need to look at one-way systems. David at Catch certainly said he had entrance and exit points. So clear one-way systems. So clear entrance point and clear exit points. So people don't end up getting stuck on stairs, corridors, doorways where there's no necessary right of way, and you've got that sort of choke point there. Use things to identify what people need to do. Explain to them, make it clear to them. I've put there, use tape to reinforce social distancing, and say David had some really good examples there. He's put it in the corridors, not where people are going to queue, but just to show how far people need to be apart from each other. A bit like if you go down the motorway, you have those chevrons. I don't know if people have seen that. You have the chevrons where you have to keep apart. How many of you go, oh, yeah, I just need to pull back a little bit there? Yeah, put those in place. Design your area. Make sure that people are informed of what they need to do, and they are more likely to do it. It's all about that communication. Putting things in place is about that communication. So tape reinforcing that social distancing is something to do. Okay, break rooms, canteens. This is something where there's a lot of interaction going on. A lot of people meet, they chat over a cup of coffee, and it is an area you need to look at. Can they still be used? Yes. Okay, they can still be used. There's nothing saying that you can't use a break room or a canteen. And in actual fact, canteens are an area that they are, I'm going to say, semi-encouraging to a point, because it might reduce people's interaction off-site and keeping those sort of pods of people in their workplaces together. But we do need to look at what we're going to do there. So the first thing we need to do, manage your occupancy levels. If it's a large canteen, you might need to reduce the seating area, reduce where people sit, rearrange that in the same way as you rearrange your office. Need to look at teams and who they're using it, and if you can keep it to a certain section of people, then that's something you need to look at. For example, you might restrict your canteen to only that office on that floor, and the next floor their canteen is, or their shared break room is theirs, and they are restricted from going into different areas. This could be implemented across the whole site, where you restrict the use of each area, you restrict where people go, and that again reduces that interaction. It's all about removing that risk. Stagger break times. So if you've got set break times in a workplace, then stagger them so that you are reducing that occupancy at any one time. The next one is encourage breaks outside. Certainly in the summer, that's a lot easier to do. I'd certainly rather be outside taking my break, but we might need to look at the sort of shelters and things like that, because outside there's a lot more space. Outside there's a movement of air, and the risk is reduced greatly by being able to go outside. So have a look at what outside space you've got. See whether you can design that in a way to encourage people to move outside, encourage people to use it. So as I say, shelters, things like that, a nice seating area, so that people can take those breaks outside. Mental health is massive at the moment, and it's certainly something you're going to have to take into account. And there is definitely a link between being outside, getting that fresh air, and mental health. So not only will this help in terms of your risk, not only will it help in terms of reducing the risk of the spread of COVID-19, but hopefully it will also have the added benefit of helping people's mental health. As I said at the start of this slide, one of the things that, like I say, is semi-encouraged is the use of canteens, from the fact that it stops people from moving off site. If you've got, let's take a staff member who decides to go down into town to go and get themselves a sandwich each day, the chances of them passing somebody who's got COVID and spreading that on and spreading that around is greatly increased. So keeping them on site is actually a good way of reducing down the spread. So look at your canteens. It does say avoid the opening of canteens, but it does actually suggest it may be providing packaged meals, which allows people to stay on site without the full opening of those canteens. It equally helps the staggered break times and helps those sort of queues areas if you've got those packaged meals, which again can be delivered to people they can have outside, or at the time which suits their break time. You will have to review your cleaning, especially with these sort of shared areas, the break rooms and canteens. And here is a definite 100% area you will need to put in the ability for people to clean themselves. You can't rely on people cleaning themselves, but giving them the options, making it easier for them, you are more likely to get that done. So make sure you've got the surface cleaner, a bit like David had. Make sure you've got that ability. Put some signs up to tell people to clean after and before use. And then increase your cleaning and sanitization of these areas. So you might have a rota for people to check and clean and make sure that the area is clean and tidy. One of the things you're going to have to do at this point, and this goes across any areas of sanitization, if you are providing cleaning materials for people to clean themselves, you need to have a policy and a way that is going to be checked to make sure they are there and they are able to be used, as in not run out. So again, you might have a system where you as a manager or a nominated person in the office goes around at the start of each day, end of each day, or something like that, and checks to see whether anybody needs sanitization stuff, spray cleaner, cloths, or anything like that, and make sure they're all in place. Make sure this is visible. And the cue I'm going to take from this one as a good example is, I'm sure everybody's seen it, is you've gone into the toilets in, I know, McDonald's or restaurant and that, and they've got up on the wall when things were last checked. Yeah, that will give the confidence that it's going to be done and give an easy visual representation for you as a manager that it is being done. So make sure that's being done in all areas, but more so in the break rooms and canteens. As I say, reduce the risk, remove the risk. So reduce the use of shared items. So if you've got shared items, look at whether it needs to be shared, or look whether people can have their own items. This could be anything from mugs to bowls to cutlery, any aspect which is a shared item. Try and keep that down to an absolute minimum. Showers and washrooms. Now, we spoke about coming into work, and certainly we spoke about sort of cycling to work and stuff like that. So what about showers and washrooms? Well, first of all, a lot of you may have communal ones where you've got more than one business on site. You need to speak to your landlord in this situation. You need to speak to the other businesses and make sure you're all coming off the same sheet of paper, making sure you're all doing the same. So have that conversation, have that meeting. I'm actually going to say here, although it is down to the landlord because it's a communal area, speak to the other businesses, speak to the other people. They're the ones using it as well, and just have that sort of conversation. So arrange that meeting now and arrange the time to have that conversation. You will need to increase the cleaning of these. They are still able to be used, even showers are still able to be used, but you will need to increase the cleaning for these. And just like the break rooms, I would have the ability for people to clean themselves before and after use, as well as general cleaning as well. You may need to keep, again, in the same way as communal areas, you may need to keep the access numbers down as low as possible. So again, it might be a case of restricting areas, restricting numbers, and try and keep them to a specific team. So Office A uses shower and washroom A. Office B uses shower and washroom B, etc., etc. This is a key point to have those sanitization stations and the entrance and exit of the shower and the washroom. You will still have to have those washrooms in place. Showers, you may decide you don't want in place. It may be something to take out, especially early on, but do look at your other policies, and especially if you're trying to encourage people to cycle to work or something like that, then these might be extremely necessary. So you may just need to look at ways of reducing down that ability and that need. Meetings then. First of all, let's avoid them. That's the easiest way of reducing down that risk. We've reduced that initial number down to 0 if that meeting isn't taking place. There is no chance of any contamination. There is no chance of any spread if there is not taking place. So let's, first of all, not have any unnecessary meetings. What is a necessary meeting? That's up to you to decide, but let's look at other ways we can have that meeting. There is no reason you can't do that meeting via Zoom, even if you're in the same office. Having to speak face to face, people have got a lot more used to these sort of sessions. They're efficient, they work. So let's carry on using them, and let's carry on using these sort of systems, and that just reduces the need for it. So does the meeting need to take place? Does it need to take place face to face? If you can remove both of those, then you haven't got a risk at all. If you do have to have that face-to-face meeting, then you need to keep the social distancing apart. So you need to look at your meeting rooms. You need to look at who's in the meeting. Do all those people need to be in that meeting? Can I change the way it's designed so that that person doesn't have to be in for the whole meeting? That allows you to keep that social distancing in place. You may well need bigger meeting rooms for meetings that are existing. You may well need to look at changing areas. If you can, why don't you have them outside? That gives you a much bigger area, makes it nice and fresh. Look at your areas, use the areas that you've already got, but there's no reason you can't have a meeting outside. So again, have a look at the place you're going to use the meeting. You will need to increase cleaning at these points, and I keep going on about cleaning, but increase the cleaning at these points. So the area ideally should be cleaned before and after use, to allow that ability. So I would again provide that ability to the meeting host, a bit like David's done with his. He had hand sanitizer and he had surface wipe in every meeting room. Again, put that in and try and encourage its use. I would almost make a bit of a point of it at the start of the meeting. A bit like most of mine, I tend to go through, if I was doing a meeting, I tend to go through the fire regs, I tend to go through this, I tend to go through that. You know, what happens to mobile phones, when we're going to have a break and stuff like that. Put in about using the hand sanitizer, put in about keeping areas clean, and make a bit of a point. Make it normal. If it feels normal for somebody to walk in, use it, then they're more likely to use it. You need to avoid shared items. So pens, paper, things like that are the obvious ones. Pens, a lot of people will put those out in meeting rooms so that people have pens and paper to make it. Encourage people to bring their own. Share documents beforehand so they can print them and bring them themselves, or even better, do it electronically. Share the documents electronically so they're not bringing in paper. You A, reducing paper, B, reducing the risk. So share things like that. Have a look at your systems. Have a look at how people can do this one. You know, I carry one of these all the time. Well, I can bring up most of my documents on here and read them on there. iPads, stuff like that. Maybe a way forward, long term. But have a look at really ways you can reduce down the need for the meetings, or certainly reduce down interaction during the meetings. You'll also make the meeting more efficient. If you can make that meeting more efficient and save 5-10 minutes on that meeting, and that's 5-10 minutes you just gained in terms of work as well, which kind of reduces down some of the loss that you might be experiencing from the social distancing side of things. People visiting site. Most people have some people visiting site, whether that be somebody to fix something, maybe that's a delivery of paper or anything like that. The people will have people visiting site. So again, first of all, reduce down the need for it. Reduce down the number of deliveries, reduce down the number of people visiting site. That reduces down the risk. The people who do visit site maybe reduce down their access to certain areas. So does the person who drops off your paper need to go to every single office, or can he have a drop-off point? So he drops, goes, and then it's moved on from there. Use radios, phones, as I've mentioned, things like Microsoft Teams to communicate. So you're not having people moving around saying, I'll just go and get this person. Again, this increases efficiency. And a lot of these measures here may not or will increase efficiency, so may not have as big an impact on the business as you may think. So using radios, phones for contact, for example, will hopefully increase efficiency across your site. Schedule the times. Does that delivery need to take place when everybody's in the office? Does the person need to come and test your smoke alarms in mid-morning on a Wednesday, or can it be done when nobody's in the office? So try and reduce down that interaction. Schedule things out of office time. Schedule things out of the time. And this is where you're also going to need to look at your business and how you manage your business. Because if you're looking at people to come at different times, people to access what you're doing or at different times, you are probably going to need to be more flexible. So you may need to look at your business and what the new normal is and how your business fits in. Gatehouses and stuff like that may need to be reduced in contact, in terms of you could get rid of the reception person and have that phone up to somebody who's sitting in an office somewhere, and reducing down that sort of contact. You may well have to have screens up in place here, and that's a nice easy way of sort of reducing that risk down. But as I said at the beginning, if you can remove it altogether, it's the best way forward. But certainly reduce down that unnecessary contact, signing in, things like that. Look at those processes. How do people sign in? Certainly visitors and contractors. How do they sign in? Do they need to do it? Can it be done sort of remotely with webcams, stuff like that? Again, encourage people and contractors to access hand washing facilities on arrival. They need to have access to these areas. You may well have a separate washroom for people who are visiting site. Like I said before, keeping those pods of people is what we're looking at here. So reducing anybody coming in, general public, contractors, delivery people, to a different washroom may well be something you need to consider, if it's at all possible. But certainly, if they're going to be there for any length of time, encourage them. The first thing to do is use hand washing facilities, use the sanitization areas, and have that nice and prominent. Communication, communicate to them what they need to do, how they need to do it, when. So a nice big sign saying, please wash your hands. People will do it. People do as they're told at the end of the day. People do as they're told. So make sure it's nice and clear. The clearer it is, the more likely they are to do it. So let's talk about cleaning. Now, if you're looking at returning to a site which has been closed for a while, you are probably going to have to clean it before you return to work. Now, is this to do with COVID? Yes, partly. But is it to do with just general health and safety? Yes. For any site that has been empty for a period of time, you are likely to need to go in and clean it. So any closed sites, clean before starting work. You've got a nice fresh surface to start with. You're going to have to look at existing risk assessments. So the one I'm going to put on here is air conditioning. Can you use air conditioning in offices? Yes, you can still use air conditioning in offices. If they were safe beforehand, theoretically, they should be safe now. However, if they've been switched off for a period of time, then they may well need to be serviced as per your original risk assessment to do with that air conditioning system, which you should have in place. Legionnaires is a big issue and will be a big issue coming about because of these offices, these workplaces that have been closed for a number of weeks. Review what that says. That may mean you do not need, you just might need to run it or something like that. Have a look at that system. Have a clear cleaning policy and make it visual. Like I said to you with the washrooms and areas like that, have those sort of times it's checked. Make it nice, clear and visual. That is all about confidence. Certainly the frequency of high touch items such as doors and printers need to be increased significantly. Exactly how much that is depends on how high touch it is and exactly how many people use it, etc., etc. But it does need to be increased significantly. Again, communicate how that's going to happen, how it's going to take place, and again, communicate so that people feel safe and feel that they are able to do it. If you can, keep areas free from personal items, keep it uncluttered. It's much easier to clean an area if there's nothing in it. So, as I say, encourage that sort of clear desk policy. Encourage people to take their personal items home at the end of the day. Have a look at your ref. Encourage people to put things in the bin straight away when they don't need it. Again, look at recycling at this point. It might be a great time to introduce that recycling policy as well that you've always wanted to do. Review your cleaning times to help with that social distancing. Like we said, with contractors, if contractors can visit out of hours and cleaners can visit out of hours, that means there's less interaction. But you may need to look at your policies in terms of when people start work, especially if you're changing times when people start work. If you're introducing flexi time, then that cleaning time may interrupt with that flexi time. So you may have to put measures in place for certain areas at that certain time. Provide, as I say, sanitization around the area. So this certainly in high contact areas such as doorways, break rooms, washrooms, things like that, and make it visible. It all needs to be visible. Signs are clear, signs are around, make it visible so people know what to do. Okay, and PPE. Now, a couple of things I'm going to say here, and this I'm going to start with the last point on this one about PPE. PPE stands for personal protective equipment, and many people in offices will not be used to using PPE. PPE is very different to a face covering, and there are lots of different regulations covering things like face coverings and PPE at the moment. Do your research if you're looking into any of this one, whether this be for barriers, whether this be for face masks, whether this be for anything else. You need to make sure you do your research. It's not clear, it's not obvious what each one is, and it's not in any sort of sensible format. The reason for that one is it is something which is fairly new to a lot of businesses, that are doing it. And also the sheer numbers that are required has meant that the increase in people supplying PPE is massive. So PPE and face coverings are different, and there are different levels of PPE face coverings as well. If it's a PPE face covering, it's protecting the user, the person wearing it. A face covering is stopping the spread and therefore protecting other people. First thing of advice, if you're already using some PPE in an area, for most offices that's unlikely, but if you are already using it, you should continue to use it in the same way. Okay, you should continue to use it in the same way. It should not change any of that. And in actual fact, at the moment, the advice, and I say at the moment because these things change, and certainly in the last week there's been a massive change in terms of face coverings, but it is the actual statement says workplaces should not encourage the precautionary use of PPE to protect against COVID-19 outside clinical settings. So what they're saying here is it's not something which you want to be encouraging into your workplace, if at all possible. Now, a couple of things to say here. First of all, what's the reasons? Why do they say that? Well, the reasons partly are to do with the wearing of it, partly to do with the actual obtaining of it. As I say, there are lots of different sort of levels of PPE here. What does that all mean? It's very confusing for a lot of people. Secondly, you've got issues with people with respiratory issues and stuff like that. So how do you actually enforce that? And for a lot of you who are not necessarily used to PPE in terms of that, it might be something which is difficult. Those are a couple of reasons here. However, I am going to say here, you do also need to think about your staff. You do also need to think about your customers, and you do also need to think about perception. And when I'm going to be talking about that one, what are people's views? It's a very visual way of showing what you're doing. And so it is something which I would say, although they're saying don't encourage it, I am going to say if people want to wear it, then certainly allow your staff to wear it. I think it's a good thing to be able to wear if people want to. So at the very least, I'd leave this down to your staff. So I would not say you cannot wear it. That is certainly something I would say you do not want to be doing. But do look at it in terms of whether it's needed, and think about how your customers see you, and what that means and what people's views are. Keep an eye on this one of what you actually need to do. I don't think it will change in terms of I don't think you will have to have it. It's certainly not required by law as of today, but these things certainly might change, and I think you'll see a lot more people wanting to wear it. One point to make here, again, less so for offices as much, but how does that face mask that somebody's wearing affect their safety at work? If you're in a factory situation, for example, could it get caught in machinery? Again, less likely in terms of offices, but it is something you need to look at. How do things interact? And that is something you're going to need to look at when we look at sort of existing risk assessments. And in fact, I'm going to mention this one, although it's a slide a bit later on. You do need to review your existing risk assessments. You do need to see how things interact. So if you're asking people to wear additional uniform, additional PPE or anything like that, will that affect their safety in another one of your risk assessments, and will you need to change that? If you've left doors open, so you've reduced that touch point, how does that affect your fire risk assessment? What have you done there? Because you've changed the risk assessment you've already got. Your air conditioning, for example, how does that affect your Legionnaires? Or even if people are working from home, is your lone working policy up to standard? Has that changed because we've gone from short-term working at home to long-term working at home? And maybe we need to look at things like the mental health policies. So how does that affect people? And the mental health policies, I'm going to say, come into it whether people are returning to work or whether people are staying working from home, because anything is to do with change. Communication is going to be key, and something which will help people going forward. So what do we need to do? We need to communicate to all measures to everybody. Health and Safety at Work Act says that no one has to attend an unsafe environment, and most of the time that people are reluctant to return to work are not because it's unsafe, but because they feel it's unsafe. They need to feel that it's a safe environment, and you need to put things in place that make them feel safe. Most of this is to do with communication. The signage may not make it any more safe at all. A sign does not make somebody wash their hands, but the sign may well encourage somebody to wash their hands, make more people to do it, and that makes people feel safer. People don't want to do things when they don't know what they're doing. So encourage that communication across the whole of the team. Share your risk assessments, show what you're doing. Put on there that you've been on a course like this, we've done a risk assessment, and this is what's come out of it, and this is how we're going to show it, and this shows you what's in place and what the risk is and how you can help. So as I said at the start, put it on your website, Share it on your social media, send it out to your staff. Make people see what you're doing. This will encourage compliance. We follow like sheep in some ways. So more people you can encourage to do things, the more people will do things. So as I said, signs, tape, make it nice and clear. And even if you're saying, well, social media is for customers, it's for your staff as well. I follow the social media feeds of the company I work for. So put it on there. And if you're showing your customers what a good job you're doing, then they're more likely to use you as well. So it's a marketing tool as much as anything else. So don't forget the marketing potential here, but show the banner of how good you are and what you're actually doing. To communicate this and communicate it to everyone. There are lots of information online for returning to work. One of the things the government have done is they put together 8 sort of documents at the moment with information on how you can implement social distancing and to be COVID secure in the workplace. Have a look at these. They're on the .gov.uk website. It's the 3rd one down here on this further information. So if you go to .gov.uk to the publication sector section, you will see there's 8 different guides on how to go back to work, and offices being one of them. There's also some good webinars they've done where they've spoken through what's in those documents. So have a read of those. That information is up there. That information will likely change. HSE actually has some good information here about working safely during coronavirus. That's quite good. And Public Health England has some great printable signs. So you don't necessarily have to get signs printed here. You don't necessarily have to cost a small fortune to implement a lot of this. There are downloadable printable signs. Public Health England, for example, link is on there, do have printable signs for things like how to wash your hands and stuff like that, the main aspects of that. So there is some really good information. I've just put through several of those together for people. Have a look at the .gov.uk website. I'm going to say the .gov.uk website is the Bible in terms of information for this. The information there will be as up to date as you possibly can get it. It will be as correct as you can possibly get it. It will be probably one of the more difficult ones to find, because I find that on the .gov.uk website, it's not always the easiest to find. And it's not always written in a way that's that exciting, but it's there, correct. The other one to speak to is your local growth hub. They'll have information on getting back to work, and that's sort of how you've come across today. So have a look at the Humber Business Growth Hub. The website address is there, and they'll certainly be able to point you in the direction of things like the documents that I've put up there, some of the links, some of the .gov.uk website areas. I want to give plenty of time for questions now. Has anybody got any questions that they want to talk about in terms of ways that they can get back to work, or anything that you know, want to talk about risk assessments or sort of things that they can put in place? Is there anything anybody wants to talk about at all? I think the key thing I want people to realize through sort of today's session, first of all, risk assessments you can do yourself. Risk assessments are something you need to do yourself, and even if you're getting somebody to do it, you need to have a large input into that. to make sure it's correct, make sure it's workable for you, make sure it's workable for your team. And that also goes through for your team. You need to get your team involved in completing those risk assessments the best you can. That kind of comes down to the communication side of things. Make sure you communicate that to your team so that they know what they're doing and they can input to it. Hive Mind will come up with some great answers to problems. So if there is a problem, ask people how to do it. That will also give them the confidence going forward. You do need to communicate everything to people, and do that in many different formats, in many different ways as you can. Toolbox talks being one of them. As I say, social media, your website, and make that as visual as possible. Make sure as visual as possible. Okay, so I've got a couple of questions now starting to come in. In terms of screenshots, I believe you can get those from the Humber Growth Hub. I think now they're going to upload this presentation as well for people to watch again. So you should be able to get those from the Humber Growth Hub after today's session. There are also going to be running some sessions on sort of factories and retail and other areas that. So we're covering each main area that people need to look at. And I know for a lot of businesses, you're going to have more than one area of the business. The principles work a lot the same between each area, but obviously there's different challenges within each area, from factory settings to retail to offices. So there will be more of these sort of sessions scheduled. In terms of templates for risk assessments, there are lots of templates. I am going to say your best option here is, I'm going to say good old Google. Google works really well for these. The key thing here is when you go back to it, go through, and let's go back to the slide on this one. Let's just go back to this, and as long as your risk assessment goes through these main points, you have covered it. There is no standard template for a risk assessment. Things tend to get a bit standardized, but that's simply from going through these documents. If you go onto the HSE website, there are some guides on completing risk assessments. They're really, really useful. They're really good, but just go through these. Have these as a title. Make sure they're not too long. So I've seen risk assessments which would be 20 or 30 pages. If you have a 20 or 30 page risk assessment and hand that to your staff, are they going to read it? Think about your staff. Are they going to read it? If my boss handed me a 20 page risk assessment of how to come into the office, I would never ever look at it. And that defies the point of a risk assessment. And that's the problem with a lot of the templates. They are too much. That slide there is the best template I could ever give you of doing a risk assessment. Go through those points, walk around with a clipboard, see what there is, add it all together, job done. It isn't something which is hard and fast. So as long as you can show you've identified the hazards, persons at risk, evaluate the risks, and what control measures you would put in place to reduce that down, that is good enough. Yeah, clear. I totally agree with you there. That clear and simple is the key, and that's the way it's going to be actually followed. A lengthy document for some people will work, and I'm probably actually going to say here that if I was writing a risk assessment for an office space, it would probably be a little bit more lengthy than if I was writing for one for Amazon delivery drivers. because my view would be that people who work in office are more likely to sit and read a 2-page document, whereas an Amazon delivery driver is probably less likely to, so it'd be more punchy, more straightforward. So simplicity, keep things simple. There's less to go wrong. That goes across all of them. Identify hazards, go around with that clipboard and make sure you can see what they're doing, and try and break it. Like Richard, I did like what David said there, is he tried to break it, and that is definitely something you need to do. See where people can make a mistake. Yeah, see where people can get your 3-year-old to try and do it, and if they can do it, then you've got it right. That's the way forward. That's the way forward. Any other questions? More than happy to answer any other questions there that anybody have got at all. Okay. Well, I think so that sort of brings me towards the end of today's session. As I say, if you've got other areas that you want to look at, you can book on to the other ones. As I say, we're going to be running one on retail. We've got one on factories. We've got one on working away from the premises. They're all sort of scheduled and be going through sort of how you can implement specific things to do with those, as well as, again, the general sort of risk assessment stuff again on each of those. So if you do attend those, if they kind of cross over into your areas. The Humber Growth Hub have their advice for COVID-19. So if you go onto the humbergrowthhub.org, you can see what advice there is there, and also what support there is there for general businesses going forward. And something I would implore every one of you to do is keep going back and checking what the growth hubs have to offer. The growth hubs are an absolute mine of information. So keep going back and seeing what it is, because it changes all the time. And at the moment, new funding, new workshops, things like that are coming about all the time. So always go back and check those. Keep in contact with these guys, and they'll certainly be able to support you going forward. There might not be something there that suits you at the moment. Speak to them, and it might come in the future. Keep an eye on what's going on. So you can say, implore everybody to have a look at that web address there. But thank you very much, and hopefully I'll see a few of you in future sessions. Yeah, thank you.